So it's been confirmed a further 14 cases, which now takes the total in the UK up to 71. What can you tell us about these new cases that have been identified?
So we are seeing further identification of monkeypox cases, and that's because we're actively looking for monkeypox cases, working with the NHS and with third sector charity partners to encourage people with symptoms to present. And that means as we identify cases and the contacts, that gives us the best possible chance to control this transmission. So this increase in cases we will continue to see over the next few days as we continue to actively look for them.
Yeah, we're talking about it a lot in the news, so people are aware of it. We understand that the risk to the wider public is low. However, we've heard a lot of talk, particularly during the coronavirus pandemic, about contact tracing. And contact tracing is being talked about when it comes to monkeypox as well. It's helping you to do your job and identify cases quickly. In that respect, are we any closer to identifying the source of the monkeypox that came into the UK?
So in our contact tracing, we're looking at both the forward contact tracing to identify people who the case may have passed monkeypox onto, but we're also doing what's sometimes known as backwards contact tracing, trying to identify the sources of this and be able to understand those chains of transmission so we can try and interrupt them. And part of that is not just working in the UK, but it's also working with our international partners in Europe and across the world to try and understand those full chains of transmission, to share the information that we're all gathering, the evidence that we're all building so we can control this. But in all of this, key is making sure that people do come forward. So we are encouraging anybody with an unusual rash or a lesion on any part of their body to contact NHS 111 or their local sexual health service.
Yeah, important to look forward in terms of, obviously, you don't want onward spread, but as you said, important to look back as well. How far back have you traced monkeypox in terms of finding the original source? Because there has been talk about a festival somewhere in Europe that may have been an original super spreader event. How far back have you traced monkeypox? Have you found it to have originated at a festival?
So we are currently following up all of these cases, working back through the chains of transmission and trying to understand common points. There may be more than one source of transmission, but this is key to actually building up that information.
Yeah, sorry, I'm just interested how far back you've been able to trace it, because people will be interested if they travel to a festival in Europe, you know, a few weeks ago. If they were there, they'd want to know if they were at risk. So I'm just trying to get to the bottom of how far back you've traced it so far.
So we're continuing with our efforts to do that contact tracing, and as we know more, we can share that risk information. But part of that is making sure we have got that full picture and we have picked up those all of those cases. And it's not just what we can do, it is actually pooling that information with our European partners so we can have the full understanding.
OK, let's talk about the 71 confirmed cases. Are all the cases adults? There has been a report that there is a child who has monkeypox and is in intensive care. Can you give us an update on that?
So I'm not going to go into details of the individual cases. A notable proportion of the cases identified to date have been amongst gay and bisexual men. So we are asking them in particular to be very aware of the symptoms and to present to sexual health clinics if they develop them.
Can we talk about how certain you are that there has been no change to the virus that has made it more transmissible? We talk about mutations of viruses, and obviously monkeypox is new to a number of countries, including the UK, outside of Africa. Have you done full genetic sequencing yet on this?
So we are undertaking sequencing on the virus, and equally this is being done internationally with other countries sequencing and that will allow us to compare it to previous sequences, both from the UK and elsewhere. But all what we're seeing at the moment is consistent with transmission from very close contact, direct contact. So that's the focus of our work and our control at the moment.
Can you put this into context for us? We understand that case numbers are still relatively low. The risk to the general public is low. It's important to stress that. But monkeypox has been mentioned at a G7 meeting of health ministers. Why the concern? Can you talk to people about, can you reassure them we're not on the verge of another pandemic? This has been described as containable, but what if it's not?
So this is the first occasion we've seen spread in the UK that we can't rapidly link back to endemic countries in West and Central Africa. But this is very different from COVID or other pandemic illnesses. The transmission that we are seeing here is from close direct contact, in particular with the lesions or the scabs from the lesions. So we are seeing those spread like that, which is very different from what we see in other illnesses. So the overall risk to the population is low. We're going to continue to investigate and control this and keep people updated.